However, this horse had recurrent problems associated with the lumbosacroiliac joint region. This is another horse showing similar but more severe postural abnormalities. The forelimbs camped underneath the trunk, abnormal prominence of the pectoral muscles, the tuberous sacrali being higher than the withers, and the hind limbs being camped underneath the trunk. In addition, this horse has an excessive body condition score, and we can see the way the crest is actually flopping over to the left-hand side in the image acquired from the front. This horse shows a rather different posture. The horse is pointing both forelimbs. The left hind limb is camped out behind the horse. The thoracolumbar region is extended and is somewhat hammock-like, and the pelvis is tilted. This horse is standing with both the forelimbs and hind limbs camped outwards, and this was a result of pain associated with a compression fracture of the 9th and 10th thoracic vertebrae, as outlined by the yellow circle. Pointing, as shown in the right forelimb here, is usually a reflection of foot pain. However, it is not specific for one single injured structure and may be observed with a variety of structures involved, including not only the navicular bone and other aspects of the podotrochlear apparatus, but also the deep digital flexor tendon. In association with chronic palmar foot pain, we may also observe that a horse may stack bedding underneath the feet. It may sit on the manger or lean its buttocks against the wall in order to some extent unload the front feet. And in some horses with chronic pain, we may see that they stand with what we call hanging carpi, or the carpi very slightly flexed. However, this can also be seen in some clinically normal horses. It also has to be said that some horses do habitually appear to point a front foot, which is not always associated with associated pain. Posture may reflect pain or, in some instances, biomechanical dysfunction. In the horse on the left, the horse constantly stood with the left forelimb abducted. This horse had an osseous cyst-like lesion in the lateral aspect of the distal phalanx and was therefore protecting this area and relatively overloading the medial aspect of the foot. The horse on the far right is also standing with the left forelimb abducted, and this horse had severe osteoarthritis of both the metacarpophalangeal and proximal interphalangeal joints, involving predominantly the lateral aspect of each joint. In the horse in the middle, we can see where you have hyperextension of the distal limb joints and marked thickening on the palmar aspect of the pastern. This was associated with dysfunction of the deep digital flexor tendon, which was partially ruptured, resulting also in mild elevation of the toe of the hoof capsule. This horse constantly stood with the right hind limb protracted, therefore reducing load on the stifle and hock, and the fetlock is also not fully extended. This was associated with a parasagittal incomplete fracture of the talus, as indicated by the yellow arrows. This horse is not bearing weight fully on the plantar aspect of each hind foot.